Nice to meet you.
Good to meet you too.
How do you feel about being recorded?
Is that something you do for most of your appointments?
Just for my sister?
Sure.
On the initial ones here.
Okay.
She's trying to be a doctor.
Oh, cool.
I'm struggling with the whole thing, so.
Yeah. Does she want... We could call her too.
No.
Okay.
I'm just going to give her this on YouTube.
Oh, okay. So you post it to YouTube?
Yeah, for my family.
Oh, okay. So could other people see it too?
Uh-huh.
Oh. What's the name you give it?
I don't.
Okay.
I don't.
Like, how do they find it?
I give my family a link.
Gotcha.
All right, so I just told my family yesterday I have cancer.
Oh, so...
Via the phone.
Sure.
Because they all live in different states.
Mm-hmm.
I'm from the East Coast.
Sure.
I came here, got sober. So I didn't want any family here.
Mm-hmm.
So I called them all on the phone and told them, and now one at a time I'm adding them to the YouTube list
Mm-hmm.
where they can watch it
Mm-hmm.
and keep it updated instead of me trying to call them or, meet with them.
Mm-hmm.
Just, I think it's going to be easier.
Sure.
And I think they appreciate it too.
Were you able to do that for I think you just saw Dr. Lassig.
I posted the whole thing.
Okay.
It's already posted. People are starting to watch it already.
Oh, so was she okay with you recording?
Yeah.
Okay. Yeah, I'm fine.
Yeah, it's not a big deal.
Yeah.
So you're going to be here instead of her?
Both. So I'll be here. So maybe it might be better if you...
Hold off?
Yeah. So I'll kind of give you talk you through it, and then Dr. Bomakanti will come in and that'll be kind of more...
I'm just going to let it go.
Yeah, that's fine. You're recording already?
Yeah.
Okay. Very good. So tell me, I know that Dr. Lassig talked to you a little bit today already, right?
Yeah.
All right. Tell me what you remember from that conversation, then I'll kind of pick up and give you more details.
Well, it's simple. I'm getting chemo and radiation as soon as possible.
Yep.
We got to get the helmet made, so I got to get strapped down. And we got a little bit of extra cancer in my chest that we're going to ignore for a while and hope chemo pulls that down.
Right.
But we got to attack my neck aggressively because it's growing.
Right. Okay.
How's that?
Yeah. So surgery is off the table. We're going to do chemotherapy and radiation.
Yep.
Totally. Yep. And we talked about your case yesterday in tumor conference. She probably mentioned that.
Top dog on the list, aren't I?
What's that?
I'm up there on the list of people who need help.
Yeah, absolutely. And we think we can help you. I mean, this is treatment that's usually pretty effective.
Yeah. Well, give it to me. Let's go.
All right.
What are we waiting for?
Yeah. First off, how are your symptoms doing?
Pain.
Yeah.
Okay. It's hard to swallow.
Mm-hmm.
I don't know if you've seen that. I almost aspirated during the swallow test.
Okay.
So we're going to have to watch that.
Did they give you any kind of alternative diet, or they said, you can just take what you can handle?
We're going to probably get
yeah.
injected. I would like a prescription for Boost or some alternative.
Mm-hmm.
So my insurance will pay for it because I'm on welfare.
Right.
So I'm hoping that'll happen.
Mm-hmm.
I don't know who's going to give me that.
Yeah, we have a nutritionist who actually works in our clinic with us, so we'll definitely have you see her.
All right.
We can try. The prescriptions for nutritional stuff is always a little bit tricky. I mean, I wish we could. We'll do our best.
Right. So we're going to have to watch my feeding or my esophagus and watch for potential problems. And if I go to the feeding tube, that's something different.
Yep.
But until then, I live in a home where they feed us.
Okay.
And I'm missing meals right now.
Sure.
So
are you able to tailor the meals, or
no.
you kind of have to take what they give you?
It's what they give you.
Because is it easier for you to swallow things that are soft?
Truly.
Okay.
But I'm taking Oxy right now, which helps the swallowing.
Mm-hmm.
And then I also have I get chloroseptic.
So it's topical.
So I topical
numbing.
before I eat.
Sure, and that helps.
Yeah, and I have the topical before in the first thing in the morning.
Yeah.
To get my coffee and to swallow my oxys because that takes like an hour and a half to kick in.
Okay. Yeah, they usually take at least 30 minutes. Yeah.
Yeah.
Okay.
Well, yeah, to get comfortable.
Mm-hmm.
And I'm going through more oxys this time around than I was last time. But
okay.
I'm not worried about it.
Yeah. Looks like you've lost about 10 pounds in the last month, huh?
I know, right?
Just because it's harder to swallow, you're eating less probably, right?
Yeah, and now my schedule with the home, I've been at the hospital every day now for...
Oh, so when you miss something
meals.
And you go back, do they save you anything? Really? Okay. They can't set aside lunch?
If I set it up.
Okay.
but I'm kind of a dingbat
It's hard to.
or absent-minded,
Well, you got to think 5 steps ahead. It's tough to do sometimes.
and I suffer from major depression.
Mm-hmm.
So, just making my appointments, which I've been doing really good, is a huge achievement.
For sure. Now, how is the pain control doing? So you take oxycodone. Does it kind of take it down to a tolerable level where you're able to swallow?
All right, so first off, I'm a recovering addict.
Mm-hmm.
Okay, I got 31 years clean.
Yeah.
I don't want to get high.
Right.
All right, so what I do is wake up in the morning, this hurts. Yeah, I need 2.
Mm-hmm.
Pop 2.
Okay.
Wait 4 hours. All right, and then decide if I'm going to have 1 or 2.
Mm-hmm.
Okay? If the pain's low, I take 1. And the prescription's for 2, but I take 1.
Good.
All right, and then every 4 hours, I see if it's going to be 1 or 2, or if I can go a little bit further.
Okay.
Than 4 hours. If I can spread it out.
Yeah.
But I've tried that, and then what happens is then I have the problem of getting the threshold back up. I have to wait for that hour and a half again, which isn't any fun. But
so you're taking it pretty much every 4 hours?
Approximately 4.5.
Yeah. Okay. Sometimes and you're using either 1 or 2.
Right.
So during the course of the day, you probably go through about 8 tabs of 5 milligrams?
I'm up to that almost.
Yeah.
Okay. The last prescription, I only did 4.
Mm-hmm. 4 a day?
Yeah, but now I'm up to 8.
Yeah. And sometimes in that setting, we use a long-acting to decrease the number, so then you have to use less during the day. It's up to you.
That's the difference between Oxycontin and Codone, right?
So Oxycontin is long-acting,
Yeah.
and sometimes we use a long-acting morphine called MS-Contin. Yeah.
Because I don't want to be high.
Yeah.
And I have real good control.
Okay.
Now, I don't know how much you can increase the dose on what I'm taking now.
Mm-hmm.
But like if it gets worse, maybe increase this dose.
It's like 2 or 3 every 4 hours, yeah.
Or, well, that's already 2.
Mm-hmm.
3 or 4 every 4 hours. Because I like to have the control. Because if I'm having a good, I don't want to take like a pill that's equal to 4 of them and then be out for 12 hours.
Right.
Right? There's no control there.
Gotcha.
That kind of reminds me of my addiction.
Sure. And usually it's released slower into the body, so usually it's not like you get a big bolus.
Right.
So it doesn't quite work that way. But why don't we just keep it how we're doing it now?
Okay.
And then if we are having to keep increasing the number you're taking every 4 hours, then
well, you guys make the decision. I'm just giving you info.
Yeah.
That's all I can do.
Okay.
I'm not a doctor. I'm an engineer, electrical.
Okay.
Not doctor.
Right. So pain when you swallow, do you have pain on the front, outside your neck at all?
Yeah.
Yeah.
Over here.
Yep.
That's horrible.
Yeah, I can see it.
The back of my neck hurts.
Mm-hmm.
I mean, my neck physically hurts like I have whiplash.
Mm-hmm.
Okay. I can only hear 80% out of my right ear.
Okay.
And 25 out of this ear.
Yeah.
Because of the lymph nodes acting up.
So if I met you 6 months ago, was your hearing
Fine.
It was normal?
Yeah.
You didn't have any hearing loss
No.
then? So this is all new?
Yeah.
Gotcha.
And then my ear, I'll get that sharp pain in there, like an ear infection.
Mm-hmm.
I don't know if you ever had an ear infection.
Not in my adult life, but I can understand what you're...
There's a sharp pain that shoots in there. That hurts.
Okay.
I just got to lay down with that.
And did Dr. Lassig from ENT, did she think that the change in your hearing is directly from the tumor pushing on the nerves?
Yeah, all the, yeah.
Okay.
And if I lay wrong, like, it'll cut the circulation off to my head.
Yeah. The reason I ask is because the chemotherapy drug we're going to use, one of the side effects is actually injury to the audio nerve.
Yeah.
But if it's from the tumor and we shrink the tumor, then your hearing will get better.
Yeah. Hopefully.
Yeah. No, we expect it to respond, yeah.
Yeah.
Okay. Pain in other areas?
No.
Okay.
Perfect health.
Yep. And the spot in the lung is fairly small. Do you have any pulmonary symptoms like any cough, any chest pain, shortness?
I have a smoker's hack in the morning.
Sure.
A little one.
Yeah.
Not much. My lungs actually are pretty good. They sound good too.
You pretty active during the day?
No, I live in a box. I live in an 8x8 box with major depression.
Yeah.
And I've been there for 6 years.
Okay.
In fact, I don't talk to anybody at all.
Except when you come for your appointments.
Well, the funny thing is now that I feel I'm coming out for my appointments, I went for coffee at a coffee house. And it's like, I want to get out of there and not be suicidal or die, because I was ambiguous whether I lived or died. Now I'm dying, and I want to, like, live. It's weird. It's the weirdest thing.
Yeah. And do you have do you see therapists or psychiatrists?
No, I have a psychiatrist who gives me meds.
Gotcha.
Therapy's out the window. It doesn't work.
Okay. Is your psychiatrist through our system?
Yeah.
Good.
Everything's in there.
Great.
In fact, I use my chart app.
Yeah, good.
It's just, everything's easy. You guys have all my meds. I have all my meds. Everybody knows who's doing what.
What's the name of your psychiatrist? See if I can find it in here.
Good God.
Maybe their notes are not in our system. I'm looking.
Yeah, there should be.
Okay.
I'm drawing a blank. I'm drawing a blank.
Yeah, let's try to see. When's the last time you think you saw him? Him or her?
3 months ago.
Okay.
I got an appointment with him next month. 2 months.
Let's see if I can see that. Johnson?
Yeah.
David Johnson.
Yeah.
Okay, very good. All right. So
I go and see him every 3 months.
Yep. And you're on, what does he prescribe for you?
Depakote and Prozac.
See that. Okay. So you have a smoker's cough.
My nose is a little bit runny, but otherwise, and the sore neck and the swelling, swollen. Other than that, I don't know, normal.
Yeah.
Weight loss.
Right.
I gotta fix that.
Yeah, and that probably won't get better until we
But I gotta
keep
fix.
going on treatment here.
I can't go backwards. I gotta go forwards on this. I gotta, like, nutrition, something.
Yep.
I gotta get a prescription or something.
Yeah, so one of the things we need to
I thought about doing a GoFundMe to get money to buy stuff, but I don't know.
Well,
if I can get a prescription, that'd be great.
Right. And once we get the feeding tube in,
well, that's not a definite.
We usually do. We put a port in for chemotherapy and fluids.
Yeah.
And do you know what a port is?
That's like goes into your IV and gives you some nutrition.
Yeah, it's a catheter. A catheter is just a tube that goes under the skin and into the central vein in the chest, and it tunnels under the skin. And there'll be like a little button on the top part of your chest so you'll be able to feel it under your skin.
Okay.
And that saves you from sticks, for finding an IV, because we can always use that to give chemotherapy and fluids. Yep. And then it's always best to give chemotherapy through a port rather than a little IV in the arm.
No, I did not know that.
Okay. Yep. So we'll plan for a port, and you'll use that during treatment for sure, both for the chemotherapy itself. And
will you give me needles of food I can just shoot in there, or nutrition?
The nutrition will go through the feeding tube.
Oh, okay.
So we'll plan for a feeding tube. Almost everybody that gets this chemotherapy and radiation at some point is dependent on the feeding tube.
Just
because this will get, while it's treating the tumor, the pain will actually, and the ability to swallow will get worse.
Yeah.
Because all the inflammation from radiation.
Can I get bottles of coffee for the feeding tube?
It won't be coffee. It'll be.
You like that?
Yeah. It may.
I know. I need to drink my coffee as long as I can until I ask for it. It's coffee, and plus I need to keep practicing.
Exactly.
I need to keep this healthy in here.
Yeah, as much as you can swallow throughout this whole process, you can continue to do so.
And my speech therapist said that they may be able to thicken the coffee too.
Okay.
But
are you choking on coffee now?
No.
All right.
No, but it hurts. I have to double swallow because have you seen the pictures how it is?
I saw them yesterday at tumor conference. Yeah. It's right at the back of the tongue, and it's protruding. Yeah.
Yeah, it's getting caught underneath and on top.
Yeah. Do you mind if I examine you?
No, I don't know.
Do you think the swelling in the neck has gotten worse over the last few weeks?
Yes, it's actually grown here where I got a couple extra bumps on the side. I'll have you feel them when you get a chance. I went for an eye exam yesterday because I have dry eyes and I thought it was something else. But I have no cancer in the eyes, no glaucoma, no nothing. perfect eyes.
Don't need glasses.
Well, 2025.
That's pretty good. Open as wide as you can. So you can still open pretty well. And no teeth. Stick your tongue out. See, I can actually see that on the right side there.
Can you?
Yeah.
That's drawn too, because you wouldn't have been able to see that.
It's pretty subtle.
You'd have to look harder.
Yeah.
So it's actually grown a little bit.
Mm-hmm.
Millimeters, probably.
Hello.
Oh, hi. So, Mr. Waltz is with somebody. Sorry.
That's okay. I'll be down.
I'm Sharon, I'm a social worker, so we're
Oh,
gonna.
sure.
Yeah,
meet
sorry.
a little bit
Do you
later, but no. But, hello.
15 minutes would be alright?
Oh, yeah, and then I think has Dr. Belcanti seen you?
Not yet.
Yeah.
We'll get you in.
Okay.
So don't worry.
Thank
Okay.
you.
Okay.
5 appointments here today.
Yeah, with this type of treatment you're going to get, there's kind of a whole team of people that'll help take care of you. Nutrition and ENT and us and social work and everybody. So
Need bus passes.
yes.
Maybe
So,
even cab. I don't know how bad I want to get my ass kicked.
does this hurt when I push on it?
No. But if you were to push on the little bumps in the back, they
Back here?
No. Grab a hold of the big one.
Mm-hmm.
Tuck in behind them.
Mhm.
Behind it.
That there?
Some little ones there.
Yep, I feel that.
And you're not pushing very hard.
No, I don't want to.
I think that's what's causing the neck pain.
Yeah. Anything under the arm swollen?
No. Perfect health. Almost.
And then what are you going to do about smoking? Do you think you'll continue to smoke, or should we?
I don't know.
We would certainly encourage you to quit. We can,
Yeah, I'm kind of thinking that you might want that.
yeah. It'll help you heal better after you're done with chemotherapy and radiation.
Yeah, I don't know how though.
You ever tried?
Acupuncture worked once, but like I don't have the fortitude to do it.
Yeah, you have to kind of have a date in mind where you can circle the calendar and say, you know what, 2 weeks from now or 2 months from now or whatever, I'm going to wean down or just go cold turkey, and that'll be my day.
Yeah, you have to have fortitude. I don't know if I have it for the smoking. It's my last vice.
Mm-hmm. You can breathe normally. All right, deep breath. Good. One more.
Sound pretty good for a smoker, huh?
It does.
30 years?
How many cigarettes do you smoke every day?
Many as I can.
Like a pack or 2
At
packs?
least.
At least a pack, okay.
Yeah.
Go ahead and lie back.
Probably a pack and a half.
How do you afford it?
$11 a month. Or $11 a carton. I roll my own.
What's in the carton then? It's just free tobacco leaves, and then you.
I buy the leaves
Yeah.
and the tubes, and I have a machine to shoot them. And it totals $11 per carton, so it costs me $45 a month to smoke.
Certainly a lot less than if you were to buy them.
Oh, amazing.
Probably not any more healthy though.
No. In fact, they might be. Well, they don't have all the chemicals, but it's stronger.
Mm-hmm.
That tobacco.
Any pain in your stomach?
No. I mean, I've been
Sit up.
fighting gas for a couple of years, but
You constipated from the oxycodone?
no.
Do you use stool softeners?
I have fiber, but I'm not using it.
Okay.
It's not a big deal. It's not relevant, I don't think.
Okay, so you've seen the radiation doctor, Dr. Elkin.
I have to see him again today.
Yeah. But you met him before.
Yeah.
Right.
Well, the Jewish guy is taking his place.
Yep. Yeah, so Dr. Rahman may pick up your radiation care.
Oh, yeah. All right. So you said the right name. Okay.
Exactly. So, details about the chemotherapy and radiation. So it'll be about 7 weeks in total.
Okay, when?
Well, let's see. The radiation is the part that takes more planning. So let me see. So you're going to see Dr. Rahman today.
Yeah.
Okay, so he'll be able to tell you when they'll be ready.
Okay, so we got to get him going first, then you're going to follow up.
Yep, because we want to start it on about the same day.
Okay.
And you know, chemotherapy, we can start that anytime we get an IV into you, to
Yeah,
be
right,
honest.
okay.
But it works with radiation together.
And he's got to set up.
It's synergistic. And so he needs to set up radiation.
Right.
When he tells us, all right, we can start radiation on this day, then we'll say, all right, we'll do chemotherapy that day too.
Okay.
That's easier to schedule.
Okay.
Chemotherapy is one drug.
Yep.
It's called cisplatin.
Okay.
The brand name is Platinol.
Okay.
It's given. We're going to give you 3 doses. Day 1, so the same day you start radiation.
Okay.
Then 3 weeks later on day 22.
Okay.
And then 3 weeks after that on day 43. So 3 total doses every 3 weeks.
That's it?
Yep. Now the radiation will be daily.
Oh,
So that's the radiation is the bulk of the therapy.
so I
Chemotherapy
only
is-
come in chemo once a week?
Once every 3 weeks. So 3
Really?
3 doses every 3 weeks. Yep.
Oh, so I don't have to sit in a chair all the time.
No, just 3 times.
I thought I had to do that. See, and then the radiation's only half hour.
And that'll be Monday through Friday
Okay.
for 7 weeks.
I'm good with that.
Yeah. Yeah, so, and the radiation actually, once you get everything set up, it doesn't take very long
Yeah.
for most of those therapies, yeah. Now, will not be easy. So, which is why we do...
I'm a recovering alcoholic and a drug addict. And I have major depression with a personality disorder.
Mm-hmm.
Cancer ain't nothing.
Okay. Now,
You don't agree with that, but
it's going to be pretty tough.
Yeah.
It's hard to get through this without...
support.
the pain in the throat will get worse because of all the inflammation. So it gets worse before it gets better.
Well, you're going to have to make the call on the meds. It's up to you.
Yeah. And like I said, at some point you probably won't be able to swallow much of anything, so you'll be dependent on the feeding tube to get your nutrition. Usually that's about 2-3 weeks after you start. So it's kind of in the middle, and then towards the end, that's 6th or 7th week is kind of when it's worse.
Okay.
And then when we're finished, you kind of recover over the next couple months. It's not like the next week, on the 8th week you feel better.
Yeah,
it's
yeah.
going to linger for a few weeks.
Okay.
All right. But hopefully you'll start to feel the masses in the neck shrink over the, so towards the middle of therapy.
Stop some of that neck pain.
Exactly.
Yeah.
Yeah. The main side effects of the chemotherapy drug, one is
Hearing.
hearing. Yep. So we kind of already talked about that.
Yep.
And so when people come in, they say, "Oh, I have hearing loss because I was in the army, or some kind of trauma to the ears." We do hearing tests and watch that very closely. Now, if your hearing is directly from nerve compression from the tumor, then that's something we hope to reverse, not make worse.
Right. So, what are you talking about? Like hearing loss, like a percentage, a small percentage?
Yeah, it's a small percentage.
I don't care.
Yeah.
It's not an issue.
But sometimes, you get the first dose, and then maybe 3 weeks later you get the second dose, and let's say you come in and say, "Gosh, my hearing, I'm ringing in my ears, it's much worse," then that would be concerning, and we'd adjust.
Okay.
So sometimes you have to make adjustments on the fly.
Keep it posted.
Yeah. Second thing is kidney toxicity.
Okay.
So this drug is pretty tough on the kidneys, which is why we always give it with fluid.
Yeah.
And why it's important that you stay hydrated.
Okay. I'm in pretty good health, so I mean my kidneys are clean.
Yep.
No drugs, no alcohol.
Yep, you've got normal kidney function. So
Yeah.
in someone who came in and had impaired renal function, we would maybe even use a different drug.
Good blood pressure, good
Yep.
sugar, good everything.
Sometimes it can cause a loss of electrolytes through the urine.
Yeah.
So we always check your electrolytes before each treatment, and sometimes you'll need supplementation through the IV, like IV potassium or magnesium or phosphate.
Okay.
Your blood counts will be affected. You'll probably develop a little bit of anemia, low platelets, low white blood cells.
Temporarily?
Temporarily.
Okay.
Because the chemotherapy drug will affect the production of your red blood
Right,
cells.
but you have counter reactors for all this, right?
So we have...
Something to counter-react everything, though, right?
Yeah, so most people don't need transfusions.
Okay.
So that's one way to counteract becoming anemic.
Really?
And then we can give booster shots for the white blood cells, but for this, it's not standard.
Okay.
Usually not necessary. Okay.
We all know it as we watch it, though, too.
Yeah. Nausea with chemotherapy can be a problem, but you'll get...
So you'll subscribe marijuana for that?
that's not actually the typical...
I'm kidding.
I know.
I don't want it.
We actually have very good anti-nausea drugs. So you'll
Okay,
get
good.
some automatically before each dose of chemotherapy, and then some you can go home with.
Okay.
That's usually only for the first couple days after chemotherapy. Once
Okay.
the cisplatin is out of your system, usually not a problem.
Okay.
So the
I like
things-
that every 3 weeks.
Yeah. Believe it or not, though, some people don't get to the third dose just because, you get pretty sick, after the first or second.
I got it.
But again, that's the combination of chemotherapy and radiation together
know.
that makes it difficult.
Give it to me.
All right.
Ain't nothing I can't handle.
Have you seen the scans?
Yeah.
Okay.
I went through the CT PET today.
With ENT.
Yeah.
Okay. Because if you wanted to look at it, we could certainly.
No, I saw it.
So the spot in the lung, again, we don't know whether that's cancer or not.
Right. Okay.
If we.
But it's lit up pretty good.
Yeah. Yep, it's right at the base of the left lung.
Why? What would it be other than?
Infection. Infection can light up on a PET scan too.
Oh, can it?
Yep. If it goes away with chemotherapy, then we have a better idea that
Right.
it's probably cancer.
Well, we'll worry about that later. I'm not too worried about it.
Yep. And we always have we already talked to our thoracic surgeon, lung
Okay.
surgeon.
Okay.
That let's say we do, get you through your 7 weeks of chemotherapy and
Still
radiation,
there.
get a really good response up here, and it's still there. Surgery actually might be an option to take that out.
That's right on my spine.
It's
Close to it.
yeah, it is, but the surgeon would certainly avoid the spine.
Just could fix my neck. It's lit up like a Christmas tree.
That's the big problem we want to address. Yep.
I mean, when you can feel it.
Yep. Exactly. What questions do you have?
I know everything.
Okay, so in the next
No, this is
week,
good.
in the next week, we'll schedule it for a port placement and a feeding tube placement. That can be done at the same time.
Next week.
Yeah, since it's Thursday already, it'll be next week.
I can do it tomorrow.
Well, we can certainly look at that as an option.
Well, actually, let's not do tomorrow because I want to get that helmet made. Because I guess that takes a while.
Yeah, we don't want to get in the way of radiation right,
Right,
now.
so we gotta get that helmet
They
made.
take priority, yeah. And then as soon as
So
radiation
let me
is-
talk to him and then I'll come back to you.
Yeah.
Is that what we do?
Or, well, honestly, when you'll see him today and we'll talk to him too.
Okay.
So we'll have an idea what your schedule is.
Okay.
So let me go get Dr. Bomacanti.
Now, if you throw, like, average day hours, throw appointments at me.
Mhm.
I don't care.
Mhm.
Set them up.
You're pretty wide open.
Put them into my chart.
Mhm.
If it's a problem, I'll let you know.
Yeah. Okay. Let me go get Dr. Bomacanti,
Okay.
and we'll just review the plan and make sure everything's set.
Okay.
Sound good?
Yeah.
Okay. Be right back in. Let me see what time your appointment with. Do you know what time your appointment with radiation is today?
Nah, don't worry about
1
it.
o'clock.
Okay.
Okay. Be right back in.
Okay, Dr. 1, half hour. Okay, I'll be back when Dr. 2 comes in.